Ethical and legal issues associated with medication errors. Group project by Brandon, Nidhi, Desiree, and Delaney.
Medication errors. Where do they happen? Reducing medicines related harm requires a clear understanding of where and when errors occur. This visual summary shows the latest estimates in England per year. As you can see, the types of error that are on here are primary care, which is 38.3%, care homes at 41.7%, secondary care at 20%, administration 54%.
In the next few slides, we'll showcase common medication errors. The 8 most common errors are wrong route, wrong dose, wrong medication, wrong time, wrong client, drug interaction, contraindicative, and not following directions. Be sure to be aware of these when you're taking care of a client. This skit will now showcase the common medication error, wrong route.
Hi Jess, I'm going to be your nurse today. My name's Delaney. Hey Delaney. Hi, it's time for your medication. So you can just take one and you're going to swallow it, okay? Do you have any questions?
No, I think I'm good.
Okay, great. Cool.
Thank you.
Great, you feel okay? Awesome.
Yeah, I think so.
In the end, the medication error was the medication was actually prescribed as a buccal medication, which would be kept on the cheek and dissolved. Instead, she accidentally swallowed the medication because the nurse gave her the wrong directions. This next skit will show the medication error, the wrong dose.
Hi, I'm going to be your nurse today. What can you tell me your name and date of birth?
Yes, Delaney Watson, 7/20/2000.
Okay, awesome. So I have a few medications for you. I have one that's 0.3 milligrams and 30 milligrams. Are you ready to take the medications?
Yes.
Okay.
Please never use a trailing zero. Nurse Nidhi mistook a 3 milligram bottle for 30 milligrams. Only use a zero in front of the decimal point. Wrong dosage will occur. In this next skit, we'll showcase the wrong medication. So, Miss Watson is experiencing high blood pressure, so we have to give her medication for it. I have hydroxyzine, and you have hydralazine.
Yep.
So
we have to give her hydralazine for blood pressure.
are you sure it's not hydroxyzine?
No, pretty sure it's hydralazine.
Okay, let's go check the medical chart.
Okay.
In the clip, Nurse Desiree and Nurse Brando were contemplating which medicine to give the patient. Was it hydroxyzine or hydralazine? Both medicines sound alike and look alike on the shelf, but have two different outcomes when given them to the patient. Which is the proper medication for the patient? Check the medical chart and confirm with a pharmacist if you need to. In this skit, we will be showcasing the wrong time. Make sure to be aware of the time.
Hi, I'm Alan. I'll be your nurse today. Can I get your full name and date of birth?
Tracy Ribeiro, 8386.
Today I'll be giving your oxycodone.
Hey, are you giving her oxycodone right now?
Yeah.
I actually just gave her the medication an hour ago. It's only supposed to be given every 6 hours. Did you not check the chart?
Oh, no, I didn't. Sorry.
This skit will be showcasing the wrong client. Always be aware of the client you are serving and which one you are taking care of at that given moment.
Hi, Mr. Downey. I'm Delaney. I'm going to be your nurse today. Are you ready for your medication?
Yeah, my name is not Mr. Downey. It's Mr. Grant.
Oh. Oh, it seems like we have the wrong person.
Yes, I am
I'll go double check that.
Okay. This skit will showcase drug interactions. Meds that can't mix, meds that mix with other things, allergic reactions. Be aware.
Hello, my name is Des. I'm going to be your nurse for today. Can I just get your name and date of birth?
Sure. Nidhi Prajapati, January 1st, 1998.
Awesome. Thanks, Nidhi. So just looking over your record, and I noticed that you're diabetic and you're currently on steroids. You want to make sure you're staying away from sugar, just so it doesn't have like a reaction to your diabetes.
Okay, I'll make sure of that. Thank you.
Thank you.
Hey girl, I'm here. How you been?
Good.
I got you your iced venti caramel macchiato, extra sugar, extra cream, just how you like it.
You can't tell the nurse though.
Give
Okay.
you our little secret. This skit will showcase meds that are contraindicative. That means when a drug would be harmful to the patient. Hello, Desiree. My name is Brando. I'll be taking care of you today. I'm your nurse. May I have your name and date of birth?
Brando, Desiree Saraceno, April 3rd, 1990.
It checks out. So you're in the dermatologist today for your yearly skin exam. We're gonna put you on medication just to help clean up the blots that you have around your body. It's called spironolactone. With this medication, you have to make sure that you do not get pregnant with it because it's teratogenic, which means it'll kill the baby.
Okay. I'm actually pregnant right now.
You're pregnant, so that's a no-go for this. But if you do you want acne?
No. Do you have something
Maybe
else?
take it.
Okay.
This skit will showcase not following directions. When a patient or a nurse does not follow the directions properly, both parties involved can fall short. 2.
It's time for my medication. Take 1. Over my mouth.
The consequences of medication errors include patient safety, nurses' career, and life or death scenarios. Nurses have an ethical and legal legalities within their scope of practice due to the high amount of medication errors that occur in the clinical and home setting. In order to distribute medication safely, nurses must have professional demeanor, be accountable, and cautious of the steps they are taking. Patients have the right to refuse medications and treatments. The ethical and legal barriers of medication errors include fear, patient trust, civil action, lawsuit, beneficence, and non-maleficence. The issue of patient harm causes ethical tension for nurses because their objective is to improve the well-being of others, not put someone in danger of harm. This causes nurses to begin to doubt their capacity to offer high-quality patient care because of medication errors.
Please keep in mind, there is only one benefit of medication errors. This benefit is keeping the nurses accountable and informed. This allows them to succeed and thrive in the workplace. In doing so, this will ensure the patient is safe, your job is intact, and there is no legal ramifications coming from a medication error.
Nora Walsh was a young nurse who lived in a 2-story house with her parents in Pittsburgh, Pennsylvania. She had 2 jobs, a full-time job in the emergency department and a part-time job as a nursing tutor. She took pride in her love for science and decided to name her 2 small Pomeranians, Pen and Vanko, after 2 types of antibiotics, penicillin and vancomycin. One day, after wrapping up a tutoring session, she went straight to the emergency department to do a night shift. In the early morning hours of her shift, a patient, Parviz Elegant, was brought in by his husband. Parviz's skin was covered in hives, his face was swollen, and he was having difficulty breathing. Dr. Arturo Reyes screamed from the other side of the room, "He's got severe anaphylaxis! Let's grab the crash cart! We need the endotracheal tube, epi, and IV fluids. Nora, I need your help on this." Nora left her coffee and rushed over to get the crash cart. A few seconds later, she was at the bedside, quickly opening up the drawers to get access to everything and rubbing her hands together with hand sanitizer. "Here you go, Doc," Nora said as she passed the endotracheal tube to Dr. Reyes. "Nora, I need you to..." Dr. Reyes was trying to tell her something while he was struggling with the intubation. It was clear. The patient's larynx was too narrow for this side of the tube. After several failed attempts, Dr. Reyes pulled out the tube and said, "Nora, I need you to get me another tube. We need a smaller diameter." Nora rushed. A few minutes later, the intubation was complete and everyone in the room took a collective deep breath. But Parviz was still critically ill, and his blood pressure was starting to drift down, a worrisome sign of shock. "Give him 2 milliliters of epinephrine," Dr. Reyes ordered. Nora looked at Dr. Reyes in a strange way, like something was clearly wrong, and she asked, "Are you sure, Dr. Reyes?" "Yeah, let's do this. He needs epi in his system, and if he doesn't respond, then I want you to give him 2 more. Nora grabbed the vial of epinephrine in the cart, which had a concentration of 1 to 1,000, and delivered 2 milliliters, which works out to a dose of 2 milligrams. A couple of moments later, the patient began to experience chest pain and heavy breathing. His blood pressure shot up fast, 200 over 120. Nora and Dr. Reyes looked up at the ECG monitor and saw the same thing. "He's experiencing severe tachycardia. We need to do something," Nora shouted. Unfortunately, the rapid change was too dramatic, and within moments, the patient had died. Dr. Reyes stared in shock and realized that he had said 2 milliliters, but that he had assumed that the vial of epinephrine had a concentration of 1 to 10,000. He had wanted to give a dose of 0.2 milligrams rather than 2 milligrams. He had ordered Nora to give 10 times more epinephrine by mistake. Nora and Dr. Reyes explained what happened to Parviz's husband, Ilan, who was stunned and horrified. Within a few months, a lawsuit was brought against the hospital, and both Nora and Dr. Reyes were named specifically because they ordered and delivered the medication that ultimately led to Parviz's death from the epinephrine overdose. Now, to rewind this back, let's imagine that Nora had precisely asked Dr. Reyes about the epinephrine dose, rather than the volume of the medication. She could have repeated the dose out loud when she was noting it in the patient's chart, and also when she was about to inject it. This way, Dr. Reyes would have probably noticed the high dose that he had ordered, and he would have reduced it to 0.2 milligrams. The moral: request medications in terms of amounts rather than volumes. Verbal orders should be written down and repeated back and confirmed, even in an emergency.
I'd like to say thank you for everybody who helped make this video a success. The performances were by Delaney Watson, Brandon Downey, Nidhi Prajapati, Desiree Saraceno, Alan Papasan, Tracy Ribeiro, and directed by Brando. If you hear or see your voice in this video and I didn't thank you, I would like to thank you for that. And thank you to Professor Dr. Wanda Williams.